Okay, I think we are all ready to start. So I would like to welcome everybody that have come to this event today, all the witness panel, the politicians, and the people attending this event that is being organised by Zero COVID Scotland. My name is Carmen. I'm very happy to be invited to chair this meeting, and I want to thank the organisers for that. Zero COVID campaigns are springing all around the world with the shared understanding of the importance of good public health. Right now, as restrictions are relaxed in Scotland, worldwide COVID cases are at the highest level yet, and the threat of new mutations which may not respond to currently available vaccines are very high. In the context of the Scottish Parliament elections, we hope that today's event can contribute to a serious reorientation of policy towards a zero COVID virus elimination strategy. The event will be organised in two parts. The first part is a panel of witnesses, 5 witnesses, that will have 5 minutes to speak with all of us. They will receive a reminder at 4 minutes so they can wrap up the presentations. Every person in the panel will then pose questions to the panel of politicians. All the questions will be answered in turn in the second part of the event. So with further ado, I would like to introduce our first witness. That is Andrew Watterson. Andrew Watterson is a professor of effective health in Stirling, and is coming to this event to speak on a personal capacity. So, sorry, before we start, I would like to remind everybody to keep their mics mute so we can have the better quality of sound possible. So please, Mike.
Okay, thank you very much. I'm very happy to give this witness statement. I've been working on COVID-related issues for some 15 months now, and I'm a public health researcher. My research stretches back, in fact, to cholera in the 19th century in British towns, where the rich considered they would be protected from infectious diseases. They thought the poor would be corralled in overcrowded districts and houses and wouldn't pass the illness on to the rich, so they needn't be too worried about the disease. This sounds familiar? There's still some debate about these early epidemics and pandemics. What was significant at the time was that a local London doctor, John Snow, without detailed knowledge of the cholera bacterium, took effective action. He recognised the significance of contaminated water supplies to disease spread and hence to its elimination, the key thing for us. He then took precautionary measures to prevent exposures by removing a water pump handle in a cholera-hit area after finding out about the disease and talking to local people. He therefore used the precautionary principle. The US established the John Snow Institute in recognition of the wisdom of this precautionary approach in public health. The current UK government hasn't followed the Snow line, but should have done, because the principle would have saved tens of thousands of lives of those in the poorest and most vulnerable communities in 2020-21 during the COVID pandemic. Of course, Trump didn't espouse the precautionary principle, but Fauci did. My work, therefore, has been underpinned by these types of principles linked to social and environmental justice. The principles apply to the COVID pandemic and to many other public health threats too. They are, firstly, use upstream and not downstream approaches to health. This is the WHO and the International Labour Organization approach. Its early population-based action will reduce or prevent individual exposures downstream that may be impossible or difficult to treat. That is elimination. That's what we're talking about. Secondly, apply the precautionary principle using a descending hierarchical approach to hazards and risks, removing hazards at source and only working down to the safe citizen as the last resort and the least effective. The principle depends on evidence-based action, but if data gaps exist and critical questions remain unanswered, then you err on the side of caution. The UK government ignored the precautionary principle when dealing with COVID and failed to learn quickly from other countries that had tackled COVID successfully early on. The UK then left the pump handle of COVID in place and didn't impose immediate lockdowns early in 2020 with lethal results. Scotland, for some of 2020, was able to apply a far better elimination strategy. The third thing is adopt a citizen science and participatory action research approach. This engages communities and draws on their experience and knowledge of problems. It increases trust, transparency, and effective communication of public health messages on COVID. So, a zero COVID approach, if it's to work effectively on elimination, requires coherent, coordinated central and local government responses with effective public health policies and action that draw on regulation, guidance, and an understanding of behavioural methods. And it's got to operate at national, regional, and local levels to avoid future large-scale lockdowns. So it would be using facts, it would be using ventilation controls, and so on. And vaccines would form just one important part of that zero COVID policy. So looking quickly specifically at border controls then, which is an important part of that. Firstly, we need necessary financial resources, staffing and support. That's so that quarantine and self-isolation are viable. Secondly, we need effective policies that must include test and trace to prevent new cases and new variants from being imported across boundaries. And when based on good and accurate data, this should help to ensure there are no large-scale lockdowns. Failure to do this on the borders in 2020 wrecked Scotland's excellent elimination record at that time, when travel had been controlled. Wales did much better. So now when new outbreaks or new COVID strains emerge, unless prompt action is taken at internal and external borders, we could be quickly back to the national and regional lockdowns. But this strategy requires a layered approach, building in the precautionary principle. It's clear that UK border controls at the moment are currently far too leaky, operate with insufficient staff in unsuitable locations, especially at airports, to check entries and quarantine locations, and we can't ensure effective compliance. The UK government has been too slow in controlling borders. If the resources and staff are there, including pre-arrival checks on travellers, then that would be much wiser. And fifthly, in terms of internal borders and boundaries within Scotland and between Scotland and England, past lockdowns for cities and local authority areas have proved effective and quick in controlling any COVID outbreaks that are due to travel movements. We've got the example of Annan and Carlisle operating very effectively early on. So Zero COVID Scotland has explored how to further reduce virus admission through effective green zone border strategies if possible. These create border bubbles, enable safe passage between the bubbles while restricting transit between areas with high virus transmission. And they're combined with vaccination and the other public health measures, FTTIS and so on. So border controls can then help to reduce spread and maintain control of the virus. So if we're thinking about the situation in Scotland, that should be possible. So we've got NHS Health Board public health staff in Scotland working with directors of public health in local authorities. And if we're thinking about the English-Scottish border, all we're talking about there is NHS Dumfries and Galloway, NHS Scottish Borders, and the local authority public health people in Cumbria and Northumberland. Not a huge task. If airport surveillance is effective too, no additional boards in Scotland would need to be involved in these sorts of steps. And both Scottish and public health communities and local economies would benefit and avoid lockdowns. Not to say it won't be challenging. The EU has found this with keeping green zones secure, particularly in terms of dealing with travel restrictions with regard to people coming from or transiting through non-green zones. But negative tests and quarantine would still be needed in some cases and should be enforced through controls along travel routes as necessary. But we're not talking about big lockdowns there. So my question to the panel is, if you're elected as an MSP, will you actively support the necessary actions needed to eliminate COVID by securing Scottish borders to prevent, as far as is practicable, new outbreaks and new virulent strains of COVID? Thanks.
Turn to Maggie Chapman. Maggie, please.
Thank you very much, Carmen, and Andrew. Thank you very much for your introductory comments and your insight into this. In some ways, for me, that's as the Scottish Green, it's a very easy yes. Absolutely, we want to do whatever we can to actively support border controls to protect our public health. I think COVID has shown us just how vulnerable so many of our systems are, our life support systems, and so many other aspects of our societies and our communities. I would love us to be able to have full control over our borders, and unfortunately we don't. It's very difficult for the Scottish Government or the Scottish Parliament to enact the kinds of border controls we know would work. The things that we saw New Zealand do, the things that we saw Australia do. It would be actually quite difficult for us to do that in a way that meets the level of the challenge, because it's a Westminster competence. And I think we need to argue very clearly for the zero COVID approach that you've outlined, to use what leverage we can to convince Westminster of this. Because yes, while there is a land border with England, we have a coastal border with the rest of the world, essentially, and that is controlled by Westminster. I think, having said that, that the UK government, being led by a man who wanted Brexit, so that probably England could be isolated from foreigners, showed his real colours when failing to close the borders to save us from COVID. His interest wasn't really about immigration. His interest seems very clearly to be about restricting the opportunities of the vulnerable, of the poor, and of those who don't have the capacity or the ability to counteract and to challenge that. So I think it's very clear we need to move to a border control element within our zero COVID strategy, and your description of the green zone border strategies is definitely something that I will be, if elected, I would be interested in pursuing further with health boards in the Scottish borders, but also local authorities. I think that there is something that we can do across the different areas of public sector work, both sides of the Scottish English border, to ensure that we get as much partnership work in communication and understanding as possible. But I think that there are a couple of other points to make in here as well. I think it means, I've said we don't have the power that we would want to have to completely to enact the kind of approach that Australia and New Zealand did. And I think that the reason that one of the reasons we didn't was a profound misunderstanding of really how things worked. I'm sure we'll have more discussion about herd immunity later on. Fiona has already spoken very eloquently about the outrageous dangers of that approach. But I think there's something about what we do in the interim, and maybe interim is the wrong word, because we aren't looking at this as we can sort COVID with independence, because I don't believe that either. But I think we need to have a very, very clear approach to disability and social security support, around proper sick pay, around adequate furlough payments that aren't tied to some kind of ludicrous return to work scheme. And we need to stop doing some of the stupid things that we know have been encouraged by the Westminster government. Eat out to help out would be one example. I think there's a very, very clear priority here around those three stages that you talked about. Upstream approaches to public health. COVID has shown us, I think, very clearly that individual health really is public health, and we need to be very, very clear about that in our financing of our investment of and support for public health. Scottish Greens have always promoted a precautionary principle approach. And we've also always promoted the adoption of citizen engagement in all aspects of life. And I think the citizen science element of this and citizen sharing of information is vital to how we tackle this in the immediate future, but also longer term. Thank you.
Thank you, Maggie. We lost Graham before, so I will take Graham next. Just a reminder of the question from Andrew was, if elected, which measure would you take to effectively protect the Scottish border from infection, if I'm correct? That's the outline of the question. Graham, please.
Thank you, Carmen, and just apologies, I wasn't able to join because of technical issues, so that's why I didn't hear most of Andrew's thing. I caught the last sentence, which I think he mentioned green zones, and if I understand what he meant by green zones, and based on what Maggie said, I assume he's meaning the cooperation between health authorities across the border in that particular region, so that you could have local travel. Say somebody works in Carlisle, they live in the borders and vice versa. They can travel locally, but everybody else is restricted. If that's what it means, then I'm in favour of the country doing that. But mainly, I think we should have closed the border. The one thing that was pretty clear from last year's outbreaks is that the international travel into the United Kingdom gave us the various variants that are now here. And then we had it widespread enough for it, because of the stupid herd immunity strategy, for it to spread and us to develop our own mutations of it, the Kent variant, for example. So there's no doubt that not closing the border was a serious public health no-no, which of course we were part of because we did not fully close our own border. And this is where I'm a founder member of Zero COVID Scotland. And the reason why I am so, because I'm totally opposed to the herd immunity strategy, and I think Fiona's outlined why that's not permissible, because any level of allowing this virus to exist in the community and to spread will involve people being long-term ill and or dying in large numbers. Now, they may not have died in as large numbers as they might have done had we not taken the measures we did. It's good that our government took the lockdown measures earlier into the cycle of our spread of the disease than other parts of the UK, but we still have had 10,000 deaths. So in my view, there isn't a permissible level of death and spread of this disease. I'm representing the Scottish National Party. I'm a Glasgow City Councillor, but I'm also first on the list in the Lothians, and I've looked at the lists, the COVID data for that area. There were 20 new cases in the Lothians in Edinburgh, and it's actually the highest in the country at the moment in terms of the numbers of cases. Now, case numbers are very small, that's good, but it seems that the current strategy of re-releasing people is not, well, my worry, of course, is that we are allowing things to reopen up too quickly without full suppression of the virus. And I think what we've heard earlier is quite right in saying that, just having vaccination as a strategy is not a strategy. I believe that the full lockdown has to occur and full elimination strategy of this virus has to be the right way of dealing with it. So as I say, I'm in favour of the strategy of green zones. That makes a lot of sense to me, and I have to say that I hope that I would wish that the English and Scottish health services could pursue the same strategy. But unfortunately, while a Tory government that thinks herd immunity is the way to go and is more desperate to open up the capitalist economy than it is to save the lives of people, that's the way it's going to go. So I think we've been misguided to a large extent by not breaking from the four-nation approach. If we'd have had a Scottish approach, we would have had a lot fewer people died, we would have had more people saved during the earlier phase of the lockdown, and we possibly might not have had to go into the second lockdown because we would have properly eliminated the virus. And by controlling borders, key part of doing that. One could also say that we didn't have control of the airports. We couldn't control who came into Heathrow and in Manchester and everybody else and driving up across our border. We could have put police cars at the border, but we didn't do that because, unfortunately, we didn't want to make it a political issue. But unfortunately, the political issue and the effect of having done that would have been to save people's lives. So I think that was worth the trouble. We should have done that. How that we should have done it.
Thank you very much, Graham. Thank you. I will take next Paul Sweeney from Labour Party. You have 4 minutes. Thank you.
Thank you, Carmen, for the introduction, and it's been a really insightful experience to listen to the people you invited along today to speak and the witnesses and their testimony. There's a lot of things to reflect on. It's actually, things that we thought about perhaps earlier in the pandemic that we maybe not, we've kind of slipped away from and have been brought back into sharp focus. And this particular question was striking in that respect, because I remember it was probably over a year ago now, about 13 months ago, talking about this issue. I mean, it might be a bit sad to admit, but I'm a bit of a. I used to have flight radar on my phone, so I was kind of like following the pattern of how this virus was spreading, and I was kind of watching this with increasing horror as planes were flying in from Lombardy into Edinburgh Airport with seemingly no government response to this emerging crisis in northern Italy, which in turn was seeded by international air travel from the Far East. And it just seemed like I was watching a slow motion car crash happening. That was my kind of interpretation of it. And it was really alarming how slow the government was to respond to that. And I think the reality is that it was such a fundamental attack to the normalization of global capital that it was impossible for the government to even begin to conceptualize the idea of control in the way that might have happened before for public health reasons. The laissez-faire approach to global capital actually kind of rebounded on this country, but did so in a way that disproportionately harmed the weakest in society and people who least benefit from that system. That was kind of my first kind of reflection on this. I mean, I don't want to make sweeping statements, but people who are going on a winter holiday in northern Italy are probably not the poorest people in society and are probably been the least affected by the subsequent outbreak. But I just think that's maybe not something, we don't want to blame people for their own behavior, but I think it's just an interesting reflection that the privilege of an international capital has in many cases rebounded in a really harmful way on some of the weakest people in society. And I think looking at how the government responded to that, we're still seeing a failure to get on top of this issue, get ahead of it. I've heard, this discussion around what powers were available. The first thing I looked at was Part 7 of the 2008 Public Health Act. And I think it's worth actually making the point here that in this act, Scottish ministers may by regulations make provision for the purposes of or in connection with giving effect to international health regulations, any other international agreements relating to the spread of infectious disease or contamination, so far as they have an effect on or regard Scotland, protecting public health from risks arising from vehicles arriving in Scotland, leaving Scotland, for persons to be medically examined, quarantined or detained, for persons to be required to provide information or answer questions in relation to health, for vehicles to be detained, for prohibitions or restrictions on the entry or departure of persons or things, the arrival or leaving of vehicles, for things to be inspected, tested, detained, destroyed, for persons, vehicles or things to be disinfected or decontaminated or detained, for the purposes of obligations on masters of ships, pilots of aircraft, other persons on board vehicles, owners or managers of ports and airports, conferring functions on Scottish ministers to create offences permitting any person in charge of respect of those functions to carry out those regulations. So to my mind, there was significant competence in the Scottish government to do something about this, and it didn't happen, and it still isn't happening. And I'd like, as an MSP, to certainly look at the scope for which we can deliver that sort of system, because I fully agree with the witness statements about the need for a zero COVID strategy. I fully subscribe to the 5 elements that were outlined. And a key one, which has been demonstrated by many Far Eastern countries, is control on international movement is critical to securing a sort of controlled environment through which you can start to eliminate the virus. Because if you continue to have a porous border, then you're simply going to keep seeding the virus when you have these movements and then out of the controlled space. So it's critical to have that control mechanism. And I think that scope was within the Scottish Government's gift. And, this focuses on the Scottish elections. I want to focus on how Holyrood can be utilised as an effective means to protect public health and save lives, ultimately. I think I would like to go in there and explore how we can utilise that more effectively going forward. I know that perhaps it's a case of, shutting the door, bolting the stable door after the horse is bolted to an extent, given the carnage that's happened over the last year in terms of the discussions we're going to have in the next few questions. But I'd like to certainly examine how we reflect on this, because it's not going to go away anytime soon, and we're going to face future threats. So we need to be much more nimble, much more effective at using these sort of powers to affect zero COVID. Thanks.
Thank you, Paul, for your response, for your answer. I'm going to take now Pam Gosal, fourth in the list of candidates from Conservative Party in Clydebank and Millgate. Pam, please.
Thank you, Carmen. And I'd like to echo what Paul said. Listening to the speakers today have really touched upon me, because I know what COVID's like. I've been there and I had it really badly. So when Fiona was speaking, I had a kind of tear in my eye, because I had a thought that I might have not been here today to speak. So this is such an important issue for me, and that's why I agreed in such short notice, within an hour. I wanted to come on this husting. But before I start, I want to pay my respects. To be honest, so many families, friends, people have lost their lives and loved ones. Economically, yes, we suffered, but I think mentally, looking at all this, it's going to take us a long, long time to come out of this. There's going to be lessons learned. There's going to be a lot of actions needed. Coming from the Black and ethnic minority, I know how much risk we're at. I know how much of my family died, and I know my friends that passed away and stuff like that. So, and I know how lucky I am to be here. So I want to start with paying my respects. But going on to Andrew's question, Andrew, I absolutely agree with you that we need to do a lot more than what we've done. And I think if this pandemic has taught us something, we need to make sure we work together. Now, I'm not here to fly the flag of no independence or independence. I'm here for people's lives, to be honest. And what's important is what we need to understand, that what working together has brought us. We've heard people talk about, closing borders, closing this, doing that. But having a four-nation approach has been amazing. We've nearly over 33 million people in the United Kingdom have been vaccinated. That's amazing compared to the rest of the world and parts in Europe as well. And then you've talked about 3.7 million in Scotland. Now, this wouldn't have been possible if all four nations did not work together to make sure we can get these vaccines out. But also what we need to understand is, and I've heard this today, the vaccine isn't the cure. Absolutely right, it's not the cure. It's there to keep us safe for the now, but there has to be many measures that we have to go down to make sure that we eliminate the COVID as we go along. Now, on border control, I think we can all, in hindsight, sit here and say that this could have been done or that could have been done. I'm no expert, and I'm not going to pretend to be a border control expert or a scientist. But what I can say is, I've got family in India right now. India is in a serious, lockdown, and it's, and the measures that the government has put in quite fast, that variant does not come here. I think, yes, I agree. Things like that should be put in place. We need to work more together and make sure that variant does not come into, spreading into the United Kingdom or even into Scotland. And this is why now I think we will probably, all governments will act very fast. And I don't believe for a second that the SNP, the Scottish government, didn't have certain powers. They had many powers. On top of the powers, they had an extra £23 billion come here from the UK government that they could have used in different measures, whether it's to do business support, NHS, different things. So I think if I could leave with a parting personal message from myself and from the Scottish Conservatives, would definitely be that let's honestly work together. And it might not suit everybody that what the answers are going to be, but if we don't provide that evidence and we're not on this husting today discussing it and making things happen and putting forward our actions, I don't think anything will happen. So it's about working together, not obviously dividing, but together. And I'd be very happy if I'm elected on the 6th of May to work with this organisation to make sure that what Andrew's spoken about and that what others have spoken about, that we can take forward and take some lessons learned and make sure we can action faster and better. So thank you.